Hi, everyone, and welcome to episode 93 of the Pet Behavior Chat. So today I thought I would talk a little bit about side effects from psychotropic or psychopharmaceutical medications. And the reason for that is because I think there are a couple of really commonly asked questions by caregivers when we talk about perhaps prescribing psychotropic meds for their pets, for our patients, for their pets. And I just want to kind of chat you through a little bit what side effects we can expect and how I navigate these conversations with the caregivers. When might I think about discontinuing medication because of side effects? What are my feelings around that? What is the evidence that we have? So I thought this would make a good topic, a good episode, because these are really commonly asked questions. So in my experience, the two biggest concerns that caregivers have when it comes to psychotropic medications are, one, that the medications are going to turn their pets into zombies or are going to change their pets' personalities. They're worried that their pets are basically just going to lie around sedated and kind of not do anything anymore. So basically, they're worried that as we're shutting down unwanted behaviors, we're shutting down all behaviors. So that's a massive concern. And that would sometimes be a reason why a caregiver won't perhaps go for psychotropic meds, or why they're really cautious or really skeptical when we're having that conversation about medications. So that's the first big concern. The second big concern that caregivers have is that there's going to be a long-term negative effect on their pet's health. So they're worried that there's going to be an effect on organs, that the meds are going to somehow cause organ failure or cause, especially kind of liver disease or kidney problems. That's something that literally every single caregiver asks me about. So those are the two sort of big topics I think that I have conversations around. And funnily enough, when I talk about transient side effects or some of the side effects that we might see in the first few weeks after initiating, especially long-acting medications, those side effects, I think, are side effects that caregivers kind of tend to tolerate quite well, or that they're okay with. They understand that they are just, in inverted commas, transient, that they should kind of go away after a few weeks of treatment. And those are usually never the big concerns. Though, that's not what caregivers tend to worry about that much. So let's talk about the first two big ones, and then we'll talk about the transient ones. So I do want to mention that I think I want to focus this episode really just on our long-acting medications, so our baseline meds. So we're talking here about the SSRIs, so the selective serotonin reuptake inhibitors, such as fluoxetine, paroxetine, sertraline, and side effects vary even within that class of medications. Side effects vary within the individual medications in that class. So fluoxetine and sertraline, for example, might have quite different side effects. So SSRIs are one big class here. The next big class are our TCAs, so our tricyclic antidepressants. Clomipramine would be the most common one here. Amitriptyline is another big one in this category. And then things like our SNRIs, so venlafaxine. So those are our serotonin noradrenaline reuptake inhibitors. And venlafaxine is the big one here in this group. And also our monoamine oxidase inhibitors. So those are kind of the four big groups. There are a couple of others. And if you do want to find out more about any more of these medication classes, then my psychoactive course is a great place to start. And I'll put the link to that in the show notes. But yeah, so let's talk about mainly our long-acting meds. Obviously, we've got our short-acting meds, and they've got different side effect profiles. Again, if you'd like to know more about that, the psychoactive course is great. And I'll probably do an episode going forwards, maybe about side effects of short-actings. But it's really the long-actings that we want to talk about today, because those are the medications that pets might be on for a longer period of time. We're talking here months, years, maybe even lifelong. So hence those questions on what are long-term effects of these medications. So the first big one the first big question that clients have is around, is this medication going to turn my pet into a zombie? And this is such a classic conversation. And obviously the answer here is no, that's not the intention of these medications. And I always say to clients, if your pet ends up being a zombie, then we're going to have to change something. We need to, stop meds. We need to reconsider. We need to think about maybe a different medication type, or whether medication is at all the best option for this particular pet. So it is never, ever our intention to turn our pets into zombies. And most of the long-term medications that we use, certainly if used over a long period of time, they don't have sedative properties. So sedative properties might occur briefly in the beginning, and we'll talk about that in a second. But given long-term, pets shouldn't be sedated. And that can be a little bit different with our short-acting meds. So with our short-acting meds, we actually sometimes want a degree of sedation. So if we're talking short-acting, we're thinking about maybe pre-visit pharmaceuticals or a medication that can help in the short term for noise events, for example. And those meds, yes, they might have a sedative property, but certainly our long-term medications, no, we don't want that. We'll talk about the transient effects in a second. And yes, a little bit of a sedative effect can happen transiently, but given long-term, that's not our aim. And the way I put it to clients is I want to actually achieve the exact opposite. I want to bring out the fun, the silliness, the goofiness, the playful side of your dog. I want them to feel so comfortable. And so we want to reduce their anxiety so much that they start to become more socially interactive again. And actually, I just saw a patient last week and who we started on fluoxetine. And one of the biggest effects of that medication was that all of a sudden the dog was coming in for cuddles, actually seeking physical interaction. And that actually made the caregivers cry, because that's not something that they'd seen from that particular dog before. So our intention actually is the complete opposite. We want them to be more of themselves. We want their carefree kind of spirit to come through. And I think once I explain it to caregivers like that, they really appreciate that, and they really kind of understand what we're trying to achieve with the medications. Now, what medications may do is they may cause a better quality of sleep, or they may cause more sleep. And this might be unexpected or just different to the caregivers, right? Their dogs, especially if they're dogs that show anxiety levels through pacing, panting, hypervigilance, they're always busy, they can't settle, they're always shadowing their parents, they've got perhaps a little bit of this hyperattachment going on. Their caregiver's presence gives them a lot of sense of security. So they're always with them. As soon as the caregiver gets up, the dog's right there next to them. Or they're patrolling the garden, maybe, the perimeter of the garden, and they can't settle. They're actually not getting enough good quality sleep. And once we initiate medications, those pets might sleep more, and their sleep might be better quality, deeper sleep. So that can look different to caregivers, but it's really important that we kind of set that tone up beforehand. We actually highlight the fact your dog's not getting enough sleep. And a few episodes ago with Dr. Carrie Tooley, we did a great episode on sleep and how much sleep our pets actually need. And so this might be something that is different to caregivers, right? All of a sudden their pets are sleeping more, and the caregivers might think that, gosh, their pets are sedated, or this is a side effect from medication, but actually it is a wanted effect. And we just need to frame it in a way that this is really positive. So that's something that can sometimes look unusual. So medications can't change personality. Medications shouldn't turn pets into zombie in the long term. And it's really important that we have those big questions. And if the medication is acting in a sedative way for a long period of time, then that means we need to go back and we need to relook at things. So that's that first big question about, is the medication going to turn my pet into a zombie? The second big question is long-term medication going to have long-term negative health effects on my pet? And there is absolutely no research to show that psychotropic medications have any deleterious effects on organ function. So there's no evidence in the literature to suggest that. I mean, we have only been using these medications, well, I say only, I mean, we've been using them probably now since the 1980s, I would say, 1980s, 1990s. So we do have long-term evidence on these medications, and still there is nowhere to show that there are any negative organ effects from the use of long-term medications. I think because we do always recommend that we take at least 6 or 12 monthly blood work from our patients that are on long-term meds. And I think that can sometimes cause caregivers concern. They're thinking, well, why are you checking bloods every 6 to 12 months if you're telling me that we don't think medications are going to have a negative effect? Well, actually, the reason that we're checking medications is to see whether there is any deterioration in liver or kidney function that might be completely unrelated, that might be for a completely different reason, that might be because a pet has a liver disease from, a different cause, or might have kidney disease from a different cause. So I think that's really important, because we want to know that, because the psychotropic medications are metabolized through the liver and excreted through the kidney, most of them to kind of varying degrees. But we want to know, is there kind of concurrent, non-related liver or kidney disease going on? Because if there is, we might need to change our dosing strategy, or we might need to look at maybe switching to a different medication. That's the reason that we're asking for the bloods. It's not because we're monitoring, are these medications having some kind of negative effect on the organs, but rather, are the organs healthy enough to continue metabolizing and excreting these medications that we're giving long term in an appropriate way? So it's really important to kind of highlight that difference. It's not that we're like, oh, are the meds causing damage to the organs? No, it's the other way around. And then another thing that I often say to caregivers is actually reducing anxiety, reducing fear, anxiety, and stress in the long term is potentially going to have really positive, beneficial outcomes on your pet's health and longevity. And there is a study that backs that up. So it's the Nancy Dreschel study from 2010. Now that study is a little bit older now, but it basically looked at kind of long-term psychotropic medication use and lifespan. And there were some interesting findings in the study. Again, it's a one-off study, hasn't been repeated to my knowledge. But basically, we do think that prolonged and chronic exposure, especially to the stress and to the stress response in the body, can have a negative effect on lifespan and longevity. And the study actually showed that there was a positive correlation between, in inverted commas, well-behaved pets and longevity. So pets that tended to be more well-behaved, in the caregiver's words, tended to live longer. There was also a correlation between pets that had fear of strangers and longevity. So those pets that were fearful of strangers had a shorter lifespan. And there were also some effects noted on fear and anxiety in relation with skin health, so skin disease and skin health, which we now know, we've got quite a few studies to confirm that we know that there's a correlation between fear, anxiety, stress, aggressive behaviors, and skin disease, atopic dermatitis, and other skin diseases. So that study from 2010 already showed that. And it's actually interesting when I quote this study to caregivers and say, well, actually, what we're trying to do is give your pet a better quality of life and a longer life by reducing their chronic exposure to stress and fear and anxiety, and the stress hormone response that occurs in the body every time that they're feeling fear, anxiety, or stress. That's usually a really kind of positive impact and a positive factor for the caregivers. So telling them, actually, what we're trying to achieve is better health, better quality of life, and a longer life for your pet by using these medications. It's not that it's going to reduce their lifespan because it's going to have a negative effect on organ health. So those are those two big kind of topics, and that's how I usually talk around those and the conversations we have around those, and the studies that I use to back that up. And I will put that Nancy Dreschel study in the show notes for you as well, so you can have a look at that. But it's definitely, I think they're really important conversations to have. And so now we need to talk about the short term, the transient side effect from meds. And yes, those can occur. And so the usual pattern, obviously not every pet is the same, but the usual pattern is we'll see side effects for the first couple of weeks. Those side effects might lift in weeks 3 to 4. And then in weeks 5 to 6, we actually see the beneficial effects of the medication, the true anxiolytic effects of the medications. And so this time frame, again, is something that I talk to my caregivers about. I tell them exactly what to expect. And it's actually funny. So sometimes again, if you've got a dog that's extremely active, stress, has quite a lot of sort of active stress responses, pacing, panting, hypervigilance, as I mentioned earlier, the side effects that can be seen in the first couple of weeks can almost act as a little bit of a relief. And then the caregivers might think, oh, things are getting a lot better in the first couple of weeks. And then as those side effects lift in weeks 3 to 4, they might feel that there's been a deterioration in behavior. So it's not uncommon that in weeks 3 to 4, caregivers might say, well, he was, a lot calmer in the first couple of weeks. Now things have worsened again. Is he getting used to the meds, or the meds not working anymore? And actually, no, that's absolutely not the case. It's just the natural rhythm, or the natural way that these medication classes work. And again, in my psychoactive course, I talk you through that whole kind of first 6-week period from a neurobiochemical point of view, what actually happens in the brain, why do we see side effects in the first couple of weeks, why do they lift, and what does it look like when those true therapeutic effects actually come in, and what actually happens in the brain in that period. So it's chatting them through that timeline, first 2 weeks, weeks 3 to 4, and then weeks 5 to 6. So what are these side effects? Now, commonly we see sleepiness, lethargy, a little bit of increased dullness. So that is due to the receptor profiles of these medications. It's due to some of the receptors that are being targeted that can cause these initial side effects of being more sleepy, lethargy, a bit calmer. And again, that can sometimes be quite a nice side effect for some caregivers. The second big one is appetite suppression. So we see these in many of the SSRIs, especially fluoxetine, paroxetine, also the TCAs, I would say clomipramine and amitriptyline. Amitriptyline in particular can have quite a flattening effect. So in the first few weeks, those patients can be quite dull, quite lethargic, especially in cats. And you need to sort of gauge to see whether the caregivers are going to be able to cope with those side effects, or whether they're going to really struggle to see their pets like that, a little bit flat, a little bit dulled. So that's the first big one, that dulling, lethargy, increased sleepiness. The second one is reduced appetite, particularly again in fluoxetine, paroxetine, clomipramine, amitriptyline, as I mentioned. That reduced appetite side effect is not as huge in sertraline and perhaps escitalopram. I haven't had a huge amount of experience with fluvoxamine, but fluvoxamine and fluoxetine are quite similar in terms of their side effect profile. So if you have a dog that's perhaps already a fussy eater, a picky eater, and especially if that side effect is something that's really concerning to the caregiver, you might want to opt for something like sertraline, although if there's enough evidence that I want to perhaps use fluoxetine, I might still push through and then just really manage that situation with the caregivers. So those appetite suppressant side effects can be a little bit different according to which medication you choose, but that would be the second biggest one. So again, dullness, lethargy, number 1, reduced appetite, number 2, and then number 3, a whole host of variable side effects depending on which medication you choose. And that's where you need to get to know the meds quite well. And again, in my psychoactive course, I chat through all of this for each individual medication. So fluoxetine is an interesting one. It has effects on the 5-HT2C receptor, which is one of the serotonin receptors that can cause what we call increased activity. Now, increased activity sometimes can be beneficial if the patient is quite shut down. So it kind of causes increased, motivation, increased activity. But in some cases, it can actually cause increased anxiety. So that activation shows as increased anxiety, increased irritability, and actually things get worse, right? Anxiety gets worse. That doesn't happen particularly often. I would say in maybe 2 out of 10 cases that I use fluoxetine on, or maybe even 1 out of 10 cases. So maybe 10% of my patients that I use fluoxetine on specifically will have that increased activation response. And then it's a case of managing the caregiver through that. Is it so bad that we really need to stop and consider switching to something else? Or are these side effects that can be pushed through? Now, I always start my patients on quite a low dose, especially in those first 2 weeks, because I want to mitigate some of the side effects. I want to see, do we have side effects? I want to see how bad do those side effects get. And the side effect profile can be so variable from individual to individual. So I always err on the side of caution. I always start low, and then I will check in every 48 hours with my caregivers in those first 2 weeks just to understand what those side effects look like. Do we need to reduce the dose even further? Do we need to go to an every other day dose? Do we have side effects at all? Are the side effects mild and we just keep going? If there's reduced appetite, how do we kind of coach the caregivers through that? Feeding them high palatable food, something that the dog really loves in that moment. So those are definitely conversations I have in the first couple of weeks, and we see, are side effects manageable? Are they not manageable at all? Do we need to augment with something? So for example, if we do have that increased activation, do we want to maybe give some gabapentin on top of that in the first few weeks just to augment those side effects? So that would be the approach that I would take. And in Psychoactive, there's literally a whole lesson I do just on side effects, managing that. How do we talk about that with caregivers? So those are all sort of the things that I would be looking at. Again, rarely we can get extra GI signs, vomiting, diarrhea, constipation, urinary retention. So those are the constipation and the urinary retention are some things that I really can consider when I'm starting cats on psychotropic meds. They can also happen in dogs, but they tend to be more common in cats. Anticholinergic effects, and there are some other serotonergic effects that can cause that urinary retention piece. So that's something that I definitely want to ask my feline caregivers about. Is your cat peeing every day? Are they using the litter tray normally? Now that gets hard, obviously, if they go outside to use the litter box, but certainly if they go outside to toilet, but certainly if they're using the litter box inside, that's something that we can monitor quite well. So those are all the side effects that I would be looking for. Again, I start low in my dosing. I see what does that side effect look like, and then if everything is manageable, or if we don't have side effects, I usually push things up the dose to a therapeutic dose quite quickly. So I would usually start at around 50% of what I think is going to be a therapeutic dose, and then I go up to the sort of full therapeutic dose. So let me give you an example of that. For fluoxetine, for example, I would start at 0.5 milligram per kilogram in the first 2 weeks. And then if everything's going well, I would push straight up to sort of around 1 milligram per kilogram. And then I would make dose adjustments going forwards as needed or not. Now, what happens if we see no side effects at all? Is that a good thing? I mean, one could say, yes, that potentially is a good thing. But for me, I always get a bit nervous and a bit twitchy if I've got no side effects at all. If I ask the client, any side effects, appetite okay? Oh no, they're completely the same, no side effects at all. Now that might be because I've started them at a low dose, but it might also mean that maybe that's not going to be the right medication for the pet. So I actually quite like seeing some mild side effects in the beginning, because that gives me confidence that actually this medication is hitting the right receptors. It's actually doing what we're expecting it to do. Those neurobiochemical processes in the brain are happening as I would expect them to happen. And that means we're probably going to get, or we're likely going to get, a good therapeutic effect from this medication for this particular patient. If we see zero side effects, like I say, that makes me a little bit nervous usually and a bit twitchy. And that's something that I think that's really important to consider. It just gives you some early information about, is this going to be the right medication for this patient? So those are the side effects, the most commonly seen side effects for the psychotropics. Now, the tricyclic antidepressants have a much wider receptor profile. So aside from serotonin receptors, they also have effects on histamine receptors, alpha 1 and 2 receptors. I said anticholinergic histamine receptors. So they've got a much wider receptor profile, which means they're going to come with a wider range of side effects. And again, Psychoactive is a great place to learn more about this, but it's really important that we know our different medication classes and we know what to expect. We all know that histamine receptors causes even more lethargy and even more dulling, which is why amitriptyline, for example, can be quite a sort of a flattening medication, certainly in the first couple of weeks, but potentially even going forwards. So that's important, right, that we know. So paroxetine, for example, has some mild anticholinergic activities. So we need to bear that in mind, and we might use that to our advantage. But we might also have extra side effects because of those mild anticholinergic side effects, receptor effects. So lots to kind of think about. And again, that's why it's important that we know our meds really well. But that's how I manage most of the big sort of conversations around side effects. So again, it's those two big topics that I think caregivers struggle with most. Is it going to change the personality, the character of my pet? Is it going to turn my pet into a zombie? What are the long-term potential effects on physical health? So those two big questions. And then managing transient side effects in the first few weeks of starting medications. Now, if you go to the Bible, which is Stahl's, which is our kind of, main textbook when we're looking at psychopharmaceutical medication. So Stahl's got a great kind of general textbook, but then also there's a prescriber's guide, which I find so useful. So the prescriber's guide is literally like a medication by medication sort of guide. You look up fluoxetine, for example, and it gives you everything you need to know about fluoxetine. And then in the side effect section on literally almost every medication, certainly the ones that we would commonly use in veterinary psychopharmacology, if you look under side effects, there are 3 lines that say wait, full stop, wait, full stop, wait, full stop. And I think that's potentially something that we struggle with, right? Like if we're seeing side effects, we want to change something, we want to reduce the side effects. And sometimes that is absolutely necessary. But a lot of the time, we just need to coach caregivers through waiting that appropriate amount of time. That could be 2 weeks, 3 weeks, maybe up to 4 weeks. But if you look in Stahl's, it says wait, wait, wait. Think about augmenting with something else. So remember I said about those activating effects of fluoxetine due to the 5-HT2C receptor. Do we augment with something like gabapentin, for example, or maybe a supplement like Zilkine? So those are questions to ask, but it always makes me laugh. Every time I go back to the prescriber's guide of Stahl's, I look at side effects and it says, wait, wait, wait. So, and I always think about that. And I think, okay, we do just need to maybe wait a little bit longer and see what happens. And it's actually funny. One of my residency supervisors, Dr. DePorter, her supervisor, Debbie Horwitz, always used to say to her, wait 7 days. That's just wait another 7 days and see what changes. And I apply that to so many of my situations or patients where maybe the caregiver's really struggling with something, or and we just have a conversation and we say, come on, let's wait another 7 days and see what happens. And it is so interesting that at the end of those 7 days, usually something's changed, and it's usually for the better. It's such an interesting thing. So that's something that I always kind of think about when I'm thinking about these situations. Stahl's prescriber's guide, wait, 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 and then Debbie Horwitz that says just wait 7 days and see what changes. Okay, I hope that's been useful. I hope that's given you a little bit of an insight into how I manage some of these conversations around side effects. And I hope that maybe that's given you some confidence to go forth yourself, use these medications, and understand a little bit better how to think about side effects and the conversations you might need to have with your caregivers. And if you want to learn more, Psychoactive is the place to go. I'll pop it in the show notes. I will also put that Dreschel study in the show notes for you that you can have a look at. And yeah, I look forward to seeing you next week for episode 94. Bye for now.